We apologize for the late start. We were just giving some additional time for others to join as they were coming from another meeting. So we will officially start now. I am Dr. Marsha James, and I'll be your moderator for this session. The topic being presented today is giving feedback that improves learning and performance in health professions education. Effective feedback is essential to learning, and educators often find delivering it to be challenging. This webinar will explore practical, evidence-based strategies for giving feedback that is clear, learner-centered, and impactful across classrooms as well as clinical settings. Our presenter today is Dr. Sweeney Gardner, consultant internist and the director of the Health Professions Education Unit, the HPEU, at UWI Mona. She's a graduate of the UWI, where she pursued the MBBS and DM in internal medicine. She also earned the MSc in medical education from Cardiff University in the UK. She brings her passion and expertise to this engaging and informative presentation today. We ask that you reserve your questions for the question and answer session at the end, but please feel free to post in the chat. Over to you, Dr. Gardner. Thank you.
All right. Thank you, Dr. James, for that introduction, and thank you for moderating this session for us this afternoon. Welcome, everyone, and thank you for joining. All right, so we're just going to go right into it. Giving feedback that improves learning and performance. So the objectives for these sessions are, as you see them there, we want to define what effective feedback is, to explain the impact of feedback on learner performance, motivation, and development, to review common feedback models and identify when to use them, to demonstrate strategies for delivering effective feedback in educational settings, and to apply techniques to foster positive feedback culture within our learning environment. So I'm going to start with a question for you. Which of the following best defines feedback in health professions education context? What do you think? So a summary of a learner's performance provided at the end of a rotation, or B, information given to a learner comparing observed performance to a standard with the intent to improve future performance, or C, general praise offered to encourage learners during clinical activities, or D, a formal written evaluation submitted to the postgraduate office. So I'll just give you a few seconds to choose your answer. You can post it in the chat. I cannot see the chat, so Dr. James will have to help me with that. I won't necessarily tell you the answer, but we can review at the end to see if that correlates with what I will say this afternoon. So about few seconds.
One option or multiple answers?
Just one. No, it's just one. All right, so Dr. James, you can let me know if answers are coming in and I can go on.
About 8 answers and everybody is saying bravo. So B.
All right, good. All right, so another activity here for you. In one word, how does giving feedback make you feel? And this is the word cloud here. Any of these words describe how you feel when you think about giving feedback? And if not, post your word in the chat. And if so, post your word from this word cloud in the chat. Hopefully that's not too intimidating. I will tell you what makes me feel stressed. I can tell you that much. Don't know if anybody is like me. Dr. James, you see the answers coming in?
Yes, so far I have none of the above, but none of the above could give us a word that would apply to them if they can find one.
Right.
One answer is accomplished. One was conflicted, obligated, stressed, obligated again,
Yeah.
helpful,
All
and
right.
one person said feedback is necessary.
Okay. Great. So we have one person on my side here. All right, wonderful. So, what is effective feedback? You know, we hear about feedback. We are in the health professions education, so we will hear about this. And some of us engage in this quite a bit and do very well at it. It's the process of providing learners with information about their work, helping them to recognize how it aligns with or differs from expected standards, with the goal of improving their performance. Right? A little bit of a mouthful there, but the truth is, it's really a kind of a process. It's very involved. And when we think of effective feedback, that's what we really need to be thinking about. And we're going to look some more at that. So when we talk about the types of feedback, when you look in literature, you see a number of words floating around with feedback. But generally speaking, you will see informal feedback, which is feedback that tends to be unstructured, it wasn't really planned, but it kind of seize the moment to speak to a learner about a bit of their performance, maybe something very brief or something very basic or it's quick, and you happen to be walking to the lunchroom and you see the learner and you may have a conversation and that comes up and you give a feedback. So that is really not structured, it's informal, but it's still feedback, and it's feedback that is thought to also be of value. Then you have a formal feedback. Now, this is more structured. It's organized. It's planned out. You have your things prepared, what you're going to say and how you're going to do this and so on. And often formal feedback is also considered to be written feedback. So you may be, after reviewing or marking an essay, you will want to have written your feedback written out and given to the learner. And it could also be due to circumstances. Maybe it is more convenient to have it written out and email it to the learner, etc., or to submit it when you mark the essay. And so there are different ways to do that. But what you want to take away from this is that formal feedback is definitely more structured and more organized and more thought through and thought about prior to it being done. And then you have formative feedback, and this came up in the faculty board meeting just now. And what is formative feedback? So we know about formative assessment. So formative feedback is kind of like that, except it's not an assessment. It is feedback, but it's feedback that is being given while teaching and learning is going on. So the course is still happening. Teaching and learning on the course is still going on. Student has not yet done the summative assessment. They may have done a mid-course assessment that you're not really contributing to their grade, which is formative assessment, or they may not have, but you seize the opportunity, perhaps mid-clerkship, perhaps 2 weeks into the clerkship or into the course, and you bring the learner in for a session of feedback. So the learner now can take that information or hopefully use that information to do better or to improve while teaching and learning is still going on. So when they get to the summative assessment or the final assessment, it is more likely that their performance will be favorable. No, summative feedback, not assessment, but feedback on the other hand, this feedback comes at the end. So the assessment has already gone and the student perhaps didn't do so well or they did well. So feedback is not only for persons who failed. Feedback is really just is information given to learners to improve weaknesses and strengthen strengths. Because the truth is they could have passed an exam, but they still have weaknesses, right? So summative feedback comes at the end of the assessment. And so the learner does not have an opportunity to improve in that assessment anymore because the assessment is done, it's graded. But in future activities like that or future assessment like that, for example, now they will have to repeat the end of clerkship exam. No, this feedback is very valuable because they're going to have to repeat the exam. So it would be great for that learner to understand, where did I go wrong? And what did I do very well? And how can I improve? And how can I, build on my strengths and so on? So that is summative feedback. So why does feedback matter? Does it matter? Right? And somebody mentioned in the chat that it is very important. It is. Really is. And so, what I have at the top here is that learners value feedback. And the truth is, sometimes I'm going to say it might be a myth because I thought so at first too. that learners or students don't want feedback. They don't want to hear what they did, But literature is telling us otherwise, that this has really been studied and shown that learners or students ask for feedback, they crave feedback, and they lament that they don't get feedback. And so it's very important. It really is important to the learner, and hence should really be important to us. And it matters because if we as the teachers are seeking to produce health professionals, who are competent in their particular profession, then we want to ensure that they are graduating and leaving us with the required competencies, right? That they are confident in doing what it is that they are doing, and what is going to help them to get there. Feedback is one of those things. So it helps the learners also to think about their own deficiencies, their own lack, their own knowledge gaps, etc. And you want that because when they think about it, they will have some impression or perception of what that may be. And after, of course, dialogue with you, who's going to subsequently give them feedback, they get a better understanding of what that may be, and subsequently will be able to design a plan of action as to how to correct that. So, and it also ties in with the next point I have there, that it promotes reflective and experiential learning, which is important for all learners, right? Because they learn as they do. Now, if they don't know that what they are doing is accurate or is inaccurate, they'll continue to do the inaccurate thing, and you don't want that. Or they will not be so confident even though they are doing the accurate thing. And so feedback helps to fill that gap, right? It develops performance to a higher level by dealing with underperformance in a constructive way. And pretty much what I'm saying is that if they're not doing so well in a particular area, and that's like the hardest feedback to give, it is necessary to give that feedback, because you want to ensure that the area that is where they are not doing so well, or the behavior that is incorrect, needs to be corrected before they exit the program. So the characteristics of effective feedback, I sum it up in these 2, 4, 5 things here, and I'm going to talk about them in a little bit more. But it needs to be clear. We want it to be timely. You want to ensure that the setting is appropriate. You want to ensure it's learner-centered, and that it is from your own observation as much as is possible. And I'm going to elaborate on that a little bit, because I know some person is like, I can't see them all the time, and that is true. So we're going to talk about that in a little bit. And so clear, specific, and actionable is what you're aiming for. No, the learner must not leave your feedback session wondering, okay, so what was I not able to do well? All right, so what did I do very well? What am I going to do next? All of those questions should be answered in that session. So you want to ensure that when you are given the feedback, you are targeting the performance, not the learner. And I believe students fear this, and sometimes we are not necessarily doing this deliberately, but it's out of culture and perhaps just out of how we talk and communicate. Sometimes we may say something that we are thinking is feedback, but the truth is it really has nothing to do with the performance. What do I mean by that? Okay, so a student perhaps examine a patient, abdominal examination, for example, and you're giving feedback on that performance, and you say to the students, you were so slow. You look like you lacked energy, and you could be a little bit more vibrant, and that is not the performance. That is the learner. You are really targeting the behavior and not the performance. So if you're targeting the performance, you want to be saying something like, you really examined the liver quite well. You were able to measure the liver span in the midclavicular line, and that was well done. But what I observe is that you're taking a little too long to complete the exam. And that is important, because if you don't finish the exam, you're going to lose marks for everything you did not do. Right? Now, that is the performance. Right? So it's important that you are targeting the right thing, which is the performance. You want to ensure that you yourself and the learner, or the person giving the feedback and the learner, are on the same page. What are the goals of this course? What were the goals of this examination session, right? What was the goal of this tutorial session? So both of you must know what that goal was. What is it I'm aiming towards? The student needs to be aware of that, and you as a teacher or preceptor should have that very clearly in your mind. Also, what are your objectives? What do you expect the student to learn at the end of this? So that when you're coming to this feedback session, that you're going to be using those things, and the learner is going to be using those things to see, am I meeting those goals, right? And you know, I find if we have those goals in mind, where the learner is on the board with and myself are on board, and the same goals and competencies, that's what we are looking for, aiming for. They are more receptive. They get to understand. Oh, but yes, I am not able to finish the exams on time. And that is one of the things that we are aiming for. All exams need to be finished in 5 minutes, right? So they know that that's a goal. So when you say, you know, the examination was not completed in time, they're say, oh, yes, that's true. That's definitely something I have to work on, right? The learner needs to understand the issues for the plan of action. So mention that a bit before. So what is the next step now? The next step cannot be you need to practice some more. That may be true, but that needs some more information for the learner. And I've had cases where I give feedback to students, and the student is like, but I practice a lot. I mean, my colleagues say that I practice most, and so I you know, I have to change that. I can't say go practice some more. I have to say something else. I have to put some more on that. So I say, okay, tell you what, when you practice, who do you have observing you? Right? So I've taken it a little bit further and say, okay, maybe you want to have 2 persons observing you who know the exam, and perhaps maybe a resident you can on the ward observe you when you examine and then give you some feedback. Right? So that is actionable. That's more specific, right? And that is definitely more helpful than giving something general, like go read some more. You need to improve your knowledge, kind of a thing. So being learner-centered. How do you make your feedback sessions learning-centered? Well, you get the learner involved in the conversation. So the learner or the student need to appreciate that, okay, so I'm coming to this feedback session, or I'm going to be having a feedback period with my lecturer, and pretty much I am just going to listen to what they have to say. No, you want your learner to be aware that you have an opportunity to speak. And how do you do that? Well, and we are going to look a little bit more on that when we look at models, giving feedback and so on. But you want from the get-go, the learner to understand that I value what it is that you have to say. And so you ask questions about what were your thoughts? Open-ended questions, make it broad, allow them to give them enough scope to speak, right? So what did you think about your performance? All right. Well, what do you think about the examination? They may not say anything. They may say, okay, what do you think about, you know, the abdominal examination? I keep using that, but that's what comes to mind first, right? And allow them to talk about that. And then you can chime in and start giving your input, right? And you give them an opportunity to reflect on their own weaknesses and strengths. I've had feedback sessions where I was so impressed with a student. I asked the student, start off the session by asking the student, so tell me, what were your thoughts about your own performance in the exam, you know? And the student will say, boy, doc, you know, I was so nervous. I just couldn't think straight, so I know I failed that station, right? Or they will say, you know, I prepared for the exam, I really did. But when I went into the exam and I saw that patient, my mind just went blank. So I know that I was not going to be successful in this exam. You know, and when I go and look at the grades and look at the comments given, sometimes these students are on point. Those students are the best students they are very receptive to the feedback because they have reflected on their own performance. They understood where their strengths were and where weaknesses were. And of course, you would also observe this and you add your input. And I find that those students do well because they are now able to fill those gaps that they have identified for themselves and that you have also reinforced from your own observation. So it's very important to have this kind of learner-centeredness in your feedback approach. We talk about a direct observation, right? I mentioned it earlier. And you may not always be able to directly observe the learner. For example, at the end of the clerkship or the essay, for it says an essay that they were given, and it was not marked by you, but you are the academic advisor and you have to give feedback. Let's just say. So you're going to have to now depend on the comments. So you may have to talk to the person who marked the paper, collect all the data that you can get concerning the essay and so on, and then come to that session prepared with facts, information. So you may not have directly observed, but what you're coming with is credible information so that when you start to talk to the learner about their performance, they will be more willing and be more ready to receive what it is that you're saying. Because, for example, you may say, somebody told me that you don't show up on the ward at all. And I say, who said that? That person just don't like me. Right? And you can't really verify that you didn't see, you were not there. And so, you don't want that kind of situation where it seems like you're using hearsay to give feedback to the student. The appropriate setting is so important. Very, very important. Because your feedback session may be very ineffective. You could be doing all the other things right in terms of what you're saying, in terms of targeting the performance and so on, which I've said already. But if your environment is not conducive to the learner receiving that feedback, you'll be wasting your time. And the environment is not just the physical environment. We are also talking about the psychological environment, the social environment, all of that. Because again, you want the learner to appreciate that this is a safe space for me. I can talk to this lecturer, I can talk to this consultant, I can talk to this teacher, right? The teacher will not go back and say, I say so to somebody else and that kind of a thing. You're in that setting, you are not having some what they call expressions that are suggesting that I think you're an idiot, I think you're a time waster, or I don't believe you. So you want to make sure your expression is not saying that to them because they're watching, they're looking at your face. So you're talking, they're hearing you, but they're also observing your face, your facial expression. What is your facial expression saying to the learner? And you see, it's important because if our aim is for the learner to flourish and grow and improve, then we have to consider our setting of giving feedback. Now, one-on-one setting is ideal in some situations, and a small group setting is ideal in some situations. So it doesn't mean that you always have to have it one-on-one, no? So on ward rounds, and I'm going to tell you what I do just to give you an example, right? And your setting might be a little different from mine because I work in the clinical space. Your setting might be in the theater, the lecture theater, and so on, or it might be in theater where you're doing surgery. But the principle will likely be the same. So you're a small group, and I will in advance say to the students on rounds, I will ask you to do an examination, and it may be any of the system examinations, depending on the patient we have. The ward round setting, residents and other students will be present, and I will have them give you feedback, right? So we'll go on through ward round, and then I'll come from a patient who is willing, and I'll say, okay, here's a patient, do a cardiovascular examination on this patient. And then we'll have other persons give feedback. And I teach the others how to give the feedback because in their minds, feedback is just saying everything is nice. So I ask the student, okay, so student B, could you give your colleague some feedback? Oh, she did very well, right? That was the feedback. So I said, okay, is there anything that she could improve? Or is there anything you would do differently? And that is when they start to think, okay, all right, maybe she didn't check the liver span, or she didn't palpate for the spleen very well. So you're teaching them to give feedback to their colleague, and you're allowing the students to recognize also this is teaching and learning. This is not criticism that is taking place here in this environment, and so they find that they are more receptive in that way. All right, so you really have to understand the learners, understand where you are, understand what kind of feedback you're giving, and so on, and choose your setting wisely. Timely feedback. So in the setting I just described, that was immediate feedback. But sometimes you can't give the feedback immediately. So go back to the situation where the student got an essay handed to do one day. Essay was marked and it was marked 2 weeks later. No, of course, feedback was not immediate. However, but they know that the grades are coming out in 2 weeks. So you don't want to wait until a whole month has passed before that learner gets feedback on their essay, because a whole month has passed and they don't know where their weaknesses are, what their strengths are, and another essay is coming up in perhaps another 2 weeks or 3 weeks or so. And so you want to ensure that you are giving the feedback in a time frame or that is close enough to the assessment or to the task that they perform, so that they can use the opportunity to prepare for upcoming and subsequent activities, right? And again, I mentioned to you that when they look at this in medical education, in studies, research, they are finding that learners actually appreciate the timely feedback, getting feedback, recurrent feedback or a number of regular feedbacks on their performance, and they appreciate the feedback, even if I'm going to say the word, but I'm going to tell you why this word should not be used, negative. So there's no negative feedback. It is rarely referred to as constructive feedback or corrective feedback, if you will, but more so constructive, because the word negative doesn't feel good. It makes you feel like something bad is happening. And feedback really is not bad. And sometimes that is why, so there's so much resistance to it, because it felt that, oh gosh, they will tell me women never do right. No, right? I want to get rid of that kind of impression, right? So barriers to feedback, there are a number of them, and when we looked at the word cloud just now, we came across some of them. The fear of upsetting the learner. So, one of the things that I've encountered, and I know other persons may have also, you're trying to talk with a student and they just start crying and crying and, dear God, what do I do? Or do I tell you to just leave, or what do I do on that time? I don't want to be talking to a student and students start crying. What am I going to do when that happens? Right? That kind of a thing. So persons are fearful of that kind of thing. I don't want to upset the learner. I don't want them to hate me. I don't want them to see me as a bad teacher, or the strict teacher, the rough teacher, that kind of a thing. And so they just don't bother to give that kind of, particularly the corrective feedback or the constructive feedback, right? They can avoid those. The predicting bad behavior or defensive behavior, resistance. I've had a case that like that, where the learner became very defensive and aggressive, and I had to say very calmly, I thought to find the calmest voice that I know and say, okay, let's try and calm down, because if you don't calm down, I'm going to have to end the session, right? So that will happen, right? And can happen. So you have to, again, when we look at planning for your feedback session, look at some of those things. These are things that you actually plan for and think through. What am I going to do, right? The inappropriate physical space. They will say, boy, I don't have anywhere to give feedback. It's a busy ward or a busy clinic, and I leave clinic and I go there and I see patients. I really don't have any space or any time to give feedback. And I want to say that time is probably one of the biggest things that we have, probably next to fear, right? And I realize that nobody really chose fear earlier. So really, maybe fear is not one of our problems, but time is a big factor, right? It's a big factor for me, for sure. I have to find the time that is going to make sense for me to give that kind of feedback. And some persons are not so confident in giving the feedback, and for the reasons that we mentioned at the top, right? They're not sure if they're going to say the right words or, do the right thing, and that kind of a thing. And so they just avoid the whole thing completely. So when I look at how do we overcome some of these barriers, right? You want to get to know your learners early. Some of us, we teach a number of courses. So it's like, know the learners, right? Every 10 weeks, I have new students. So I don't mean individually know the people, right? Because that's not going to be practical for sure. But when you are teaching a course or a session, get an idea of what your class consists of. Are these students, are they more what should I say? Are they more talkative students? They like to express themselves, or these students are the more reserved? So you generally can get that kind of feel as to what kind of class do you have, right? Do you have half of the class more reserved, and you have a few who are always talking and always, chiming in and giving answers, that kind of thing. So you have an idea of who your learners are. It's important because when they call it building rapport with your learner, right? When you get to know who they are, get an understanding of what are the kind of nuances that exist as it relates to even them communicating. You still can observe how they communicate with other students, with other persons, other lecturers even, and get an idea of what kind of persons that you're dealing with, because in that way you will appreciate, okay, maybe I can give feedback to the student when other persons are around, because even if it's you are being doing following everything correct, it might not go down well for them because they just don't like being around people like that, hearing that kind of news kind of a thing. So that is important. Building rapport, let your learners also get to know you. Let them know who you are. So it could even be in a lecture hall. So you're teaching a large group of students in a lecture theater. How you communicate with the students. You're standing behind the podium and stay there for the entire lecture, right? And you don't move. It communicates something to the learners. They might say, "Oh, this lecturer probably don't really want to come close to the students. They're more kind of strict, or it may communicate those things to them, even when that's not the case. But maybe if you move around and if you kind of engage the person at the front or engage the person at the very back, they find, oh, this person, I can't talk to this person, that kind of a thing. So it's that building that kind of a rapport with your learner is important, and it will facilitate ease of giving feedback and their part receiving feedback in the future. So you want to inform the learners of what is going on. So I spoke earlier about from the outset, letting them know, okay, so on this course, this is what's happened, this is what's going to happen. This is how I'm going to be teaching, this is how I'm going to be assessing, and this is how I'm going to give feedback. I will give feedback to you after every session. I'll give feedback to you at the end of 2 weeks. I'll give feedback. So the learner is looking forward to this thing happening, right? You want to choose your location. So we spoke about location quite a bit just now. Set the time and duration. So again, you'll let the learner know, okay, so in 2 weeks' time, we will meet. We are going to have a session about 5 minutes on your performance in a particular area. Right? So clearly you can't go through a whole long list of things in 5 minutes, but 5 minutes is what you generally have because you have to give feedback to 2 other students or the 3 other students. All right. And you want to choose the appropriate technique and follow the core feedback principles. So we're going to look at some technique in a little bit, or models in a little bit, but the truth is really about planning it out, right? And you may not even choose or use a technique rigidly. And in fact, when I go through it, I will discuss that a little more. It doesn't really require that you follow it rigidly, but what it is doing is giving you some kind of a structure that you can use and follow and practice with, so that over time it becomes easier. And I've found that to be true, right? And you want to avoid unwanted nonverbal cues, as I mentioned before. Then when you finish your session, so this is what now is also very important. And this helps me because I go back and think through, okay, so maybe I shouldn't have done that, But when the learner did that, when I said that, the learner was a little, teary-eyed. So maybe next time what I'm going to do is do it this way. So you reflect on what you've done. How did it go? So you just also you ask the learner, oh, how do you think your performance was? Now you're asking yourself, so how did I think my performance was in giving feedback? What should I improve? What went well and what will I continue to do? That kind of a thing. But the big thing here is to overcoming barriers, planning it out. Because we are so busy. If we don't plan anything, it doesn't, well, if I don't plan anything, it doesn't really get done. I have to put everything in my calendar. Like as soon as I hear it's gonna happen, I put it in, or I said, I don't remember it. Like completely. So you want to plan it out and have it all laid out in your head or in writing, so that when the time comes for this to happen, it is much easier to do. Common pitfalls that we want to avoid when giving feedback is that we want to avoid not creating that feedback culture, right? And so all of what I discussed before is really geared towards creating a feedback culture. Now, I will have to say, right, I studied at university for everything except for the medical education degree. And I am telling you, I really did not come across this feedback culture. It was not something that was very prominent. I didn't even know that there was a culture of such, right? And so, in other words, I didn't really receive much feedback on anything really. I kind of just make assumptions based on certain outcomes and so on. We don't want to do that for our learners. We want to create a culture where they know that they can get feedback. They know that at certain time the feedback is coming on a particular course and so on. And that way, some of the barriers that we perceive that exist will actually start falling, right? And so that's what we want to look at. How do you create the feedback culture, you ask? Some of the things that I mentioned before, right? We look at the principles about being clear and timely and so on. All of that is important. Look at the environment, that is important. Learning about your learners, having rapport and so on. All of that is a part of creating that culture. And when it becomes a part of your culture, then the ease of creating that culture around you will be evident. Delaying feedback, that's a big pitfall. Number of things when it happens when you delay feedback, and I mentioned some of them, is that the learner doesn't get a chance to benefit from information that could help them going forward. If it's not given a timely fashion, then you may forget the things that you need to give feedback on, right? And so you may not come with very accurate information, depending, because sometimes it may be written or it may not be written, depending. And then the learner themselves may not even be able to give you any kind of to reflect adequately on their performance because they don't remember. I remember I had a session with a student and I said, ask the same question. Can you give me your thoughts about your own performance? And they're like, why I don't even remember what happened that day. Right? They couldn't tell me. And so that was not so good because no, she just gonna go based on my own observation and impression of her performance because she don't remember the exam. She don't remember what she did. At least that's what she said. But it was some time after, so it is very plausible that was the case. And so we want to try and avoid those kind of things. Do not give too much information. Don't overload the learner, right? Especially if there is a lot of corrective feedback that is needed. Perhaps you want to cover two things now, and then maybe another time you set another feedback session and do correct two more things, right? So you want to limit the amount of feedback you're giving in one session because it might be counterproductive. And using humiliation, that is a no-no. If you want your learners to not do well, you will humiliate them, especially this generation, right? In my generation, you humiliate us and you feel bad for a couple of days, maybe weeks, maybe months, but then you bounce back because you say, well, I have to do this and get it done. Unfortunately, what I am experiencing, and I know of others experiencing this too, is that some persons are beaten down and they just don't bounce back. They have difficulty coming back from that. They always just remember being humiliated on a ward round and they just can't come to a ward round. I had a student who was so anxious about coming to the ward. I mean, I didn't get a chance to explore what was happening, but I just didn't see the student. And I tried to find out where the student was. And we met on the corridor and she said, she was the one who said, Dr. Gardner, this is so-and-so. I said, what has happened to you? And she said, Dr. Gardner, I get very, very anxious. Like, I just can't come to the ward. And me, I don't know what her experiences were, but really, humiliation does not benefit our learners. I want to try and avoid and move away from that kind of approach in dealing with our learners. And giving feedback only when after an assessment. Of course, so again, we talk about the building rapport aspect. That was not built because every time you do it, it's after an assessment. So, it didn't get a chance to be given feedback throughout the course. And so the learner gets to know who you are and, how you communicate and so on and get used to you, them being in your space and so on. And now after every exam, they might become anxious and you might just be after that exam that you taught on. So, you don't want to just limit it there. That's why it's a pitfall. We talk about building the feedback culture is what you want to do. So methods of giving feedback, there are a number of them. We have written, and you have verbal, which can be audio face-to-face, online, or via video. And it can be an audio recording of your feedback, right? So we have the virtual learning environment, or you can record it and send it to the student. I have written feedback that I've sent to the student, and ask student if you desire further feedback, we can schedule an appointment. Right? So we have that. 2 students wrote back and said, oh, this was very clear. I understand and I received this feedback, and she was fine. Right? So you want to also make sure if you're writing the feedback, you're not writing in short. You're not going to write 5 pages of feedback and nobody's going to read it, but you want to make sure that it's very clear and concise, to the point, but adequate, right? In terms of written feedback. And online, so like on a Zoom platform or Microsoft Teams or whatever online platform that can be used for the feedback, you want to make sure that your camera is open, and I would recommend that you don't insist that the learner's camera be on. When I do it this way online, I don't generally insist that their camera is on, but I always put my camera on. Just so that they can see me communicating, see my expression, and so on. And I believe that is important. Again, building rapport with your learner. Can be audio recorded, so there is no video, just audio that is recorded, and you can post that in your virtual learning environment or email to the student, etc. And the benefit of doing the audio recording and the video recording over the written is that you might be better able to express what it is that you want to say, to the learner, in a better way, than if it was just written. And of course, good old face-to-face sessions that you have with the learner. So we are going to look at models of giving feedback, and I want to point out that these are models that various researchers came up with. And also physicians have come up with some of these as well. In their own practices, they find that these things work. And one of the old ones that has been criticized quite a bit and modified in some aspects is the feedback sandwich. It is one where you really want to sandwich criticism with praise, kind of smoothing it down, kind of a thing. At least that is one of the criticisms of this feedback, is that, you start off with saying something pleasant or giving something good, saying something good about the learner. So, you did very well at examining this patient's chest, and but I realized, you see, I said a word I really should not be used. But means something bad is coming. So you're trying to avoid using the but, right? So you're trying to move into the corrective feedback without using but, or using another word that's going to suggest that something negative is coming, right? So you give the praise or the reinforcement feedback, saying that you did well at this particular aspect of your performance, and there is this aspect of your performance that could be improved because I noticed that you did it this way, but generally this is how it is done. I encourage you to continue to examine the cardiovascular system this way, and continue to complete the exam on time, because that is very, very important. So you start with a reinforcement feedback. You say what it is that you want to correct and how you want how you're proposing that it to be corrected, and you're closing off with another reinforcement feedback. All right, and then this the benefit of this feedback is that it is quick. It is like one of those quick feedback you can and give, and it can be quite effective if it is done well. All right. So this slide now is talking about the strengths. That is acceptable by a learner as the impact of critical feedback is cushioned by the positive feedback. So learners tend to accept this. They're not starting off by saying, boy, you should have really done this better. Right? You're starting off by highlighting their strengths, highlighting what was good. It is structured because you know what it is that you're saying first, you know what it is you're going to say next, and you know what you're going to end with or how you're going to end. So it is structured. And it's useful for passive or low insight learners and for inexperienced educators. So you notice with this feedback is that you didn't ask the learner anything. The learner didn't get a chance to participate. All right. And as we spoke about being learner centered and so on. So that is really one of the criticisms of this feedback sandwich here. So we look at the weaknesses here: anticipation and increased tension, knowing that critical feedback will be received. Mostly focused on the educator. So it's a monologue. And it's there's a false positive if encounter is mostly focused on reinforcement and positive feedback. So the learner or the student could leave you just hearing the positive and didn't hear anything that you said about what needs to be corrected. Right? So in using this kind of approach, you have to be careful that the other principles that we spoke about are incorporated. So you want to make sure that you're clear in what it is that you are reinforcing. You want to also be clear about what it is that you are correcting and how you wish you are encouraging the learner to correct this, right? And you want to ensure that when they leave you, they are motivated to go on to improve in the areas that they need to improve on, but be confident enough that there are positive aspects to their performance. Then you have the set goal model. And this model speaks to an approach where you are now engaging the learner more. So you ask the learner, so what did you see, or what is your observation then of your own performance or of the activity that you were asked to do, and so on. And then you ask them to explore even further. So they may say to you, oh, you know, I didn't write about the full process of a particular thing on the essay, right? Can't come up with a suitable example right now. But I didn't write the full thing that needed to have been written. And I recognize that when I came out of the exam, I could have written more. And then the teacher or the tutor or lecturer will say then, all right, okay, all right, noted, that observation is noted. Is there anything else that you saw that you could have improved on? And so you kind of keep encouraging them to say more, reflect some more, and talk a little bit more about the experience. And then you ask them, so what do you think? So it's all about really hearing from the student, hearing from the learner, and your role here is to reinforce what needs to be reinforced and to correct what needs to be corrected. And you're really observing whether or not this learner has insight and good insight into their own abilities and also their gaps as well, right? And you also want to ensure, so that this is where the goal aspect of this model comes in. What goals are we trying to achieve? So you want to end your session by looking at the goals. All right. So these were the errors that were made. And this is what we are going to look at now. We're going to see how we can do A, B, and C to achieve this particular goal at the end, right? And so you end your session that way with the learner knowing exactly what to knowing what was done, what needed to be corrected, what was done well, and what it is that I now need to go on to do. Strengths. Focus on descriptive feedback to encourage a non-judgmental approach. It's effective when delivering in a group setting. It is also thought that this is better to do in a small group or in a group setting rather than in a one-on-one, but it can also be modified for a one-on-one. Encourages peer feedback and joint problem solving. So remember I talk about on a ward when we have a small group, we have persons giving feedback to the learner. It facilitates vicarious learning and reflection through the experiences of others. It's not recommended for the individual feedback, as I mentioned, but though you can use some elements of it or you can modify it for individual feedback. It requires having enough time to involve the whole group. It's unsuited. So again, this might be time sensitive. So if you have only 5 minutes, maybe you don't want to use the set go approach per se to conduct the feedback session. Unsuitable for informal feedback encounters. So it's more something that is structured, planned out, organized if you're going to seek to use this model. Because if you remember from the first slide, the slide before this one, it talks about, it keeps probing the learner. So you're trying to get as much out of the learner as it relates to their reflection and their own thoughts as is possible. If you're going to do it in a small group setting, you can imagine how much time that is likely going to take. So you are prepared for this kind of time that will be needed to facilitate this kind of feedback. And it says here, it requires learners to develop feedback skills as the whole group is involved. And so this is something that is one of the models that is will be used in persons who are used to this kind of feedback, used to understanding, develop the skills of giving feedback over time. So this in a group of persons who are new to this, perhaps this is not the method that you want to use, because again, if it's in a group setting, you want to ensure that as they're giving peer feedback, they are aware and know how to give this feedback. All right, so the next model I'll mention is the agenda-led outcome-based analysis. And this one is thought to be very learner-centered. So as you see here at number 1, the learner is the one who sets the agenda, so to speak. Yes, it is a session that is going to be organized by yourself, but it's also going to be a situation where the learner is going to say, I would like for us to talk about these things and these things and these things. And you are there really facilitating that facilitating the session. So a learner will identify your learning needs. So I'll tell you, look, I realize that I am not very good at doing A, B, and C. I believe I need more teaching in this area, or I need more tutoring in this area, etc. So they are identifying their learning needs as they see it. They want to clarify what the objectives are for the course, perhaps, and also clarifying the objectives for the session. They want to state the priorities for the feedback discussion, what it is that they want this feedback session to accomplish. Right? The learner self-assesses, reflects on performance, identifies strengths and gaps, explores reasoning and decision-making. So the learner is going to self-assess. Educator builds insights, so it links theory to practice. It provides descriptive, balanced feedback, reinforces effective behavior. So you're, as the lecturer or tutor, you are really in that session to ensure that you're reinforcing the good behavior, or reinforcing the things that the learner is doing well, and you're correcting those things that are needs to be corrected. The collaborative problem solving. So how do we move on from here? Both lecturer and the student and our students will jointly design a plan of action going forward, and a commitment is made to accomplish these things and revisited at a later date. So priority is given to the learners in this approach. Learners' reflection is supported strongly. The dialogue is definitely reinforced here. The learner is very much a part of the whole process and is involved in what is going on in this feedback session. And the lecturer is really there facilitating what takes place in this session. It's unsuitable for informal feedback, as you can imagine. More suitable for individuals as opposed to groups. And again, it requires the learner to have some insight and ability to reflect on their own skills and their abilities and also their gaps. And this, I would say, it's not like you're waiting for the learners to learn this. You're waiting for them to learn how to do this. But I believe it is taught. And so it may even be taught through the informal feedback sessions that are being had. Right? So it's not like say, oh, well, my learner them have no insight, so that's not going to work. It starts somewhere. So we talked about the rapport earlier. It's teaching them this as well, because again, if there's no feedback culture where they are, and I dare say, feedback culture is really not something I see even in my immediate space where I teach. It's something that has to be built, and it has to be built over time. They develop skills and judgment by the educator to provide balanced feeds. And again, the educator as well, or the lecturer teacher also will have to develop the skills. And this again occurs over time in giving the feedback. The Pendleton's rules, again, what was good in your performance? We talk about that. Agree on the good points. What could have been improved? And then you suggest the improvements going forward. And I have a video to show you how, an example of what that may look like. The strengths, safe environment, is a dialogue again, not a monologue. Supports the learner's initiative and is useful for learners who may not really be ready to, not one of those outspoken learners, probably a more reserved learner. So I help you to bring out, that the person that you don't normally see. You may to probably generally see somebody who's quiet and not talkative, and somebody you may be more likely to say, oh, this person don't really, not interested. But the truth is they're just their personality. And so this kind of approach will help to pull, that person out of their comfort zone as it relates to how they normally behave and become more comfortable speaking and expressing themselves. Weaknesses, anticipation and increased tension, knowing that critical feedback will be received. And I suppose it's difficult to avoid that completely. Hence, feedback culture that we talk about that needs to be developed. So unsuitable in practice during clinical care, again, in a busy setting might not work so well. Risk of not covering aspects to improve when time is limited. And so you want to make sure you have enough time to give the feedback. The rigid structure prevents an interactive discussion. And I want to say, when we look at these models, I don't see it as something that you're just going to use rigidly. Certainly, it's something that should be flexible. You should be able, again, based on your learner, based on your situation and your circumstance, and you can make some adjustments. Not like, oh, if I don't do this, like Pendleton said, it, boy, is not, I'm not doing it well, kind of a thing. I believe it's adopted and adapted to your circumstance. The ask, tell approach. And I'm mentioning all of these not because I'm saying, boy, you're just going to use all of these as it relates to giving feedback and ensuring that you give effective feedback. But I want to be aware that these various ones are out there, and there are others out there as well. But these are some of the more common ones that you will hear persons talk about and that you will see in literature that are used. And this one is not a quick one. It is similar to the feedback sandwich. In fact, it is thought to be a modification of the feedback sandwich, where so you give the learner self-assessment on what went well and so on. And this is what is not in the feedback sandwich, right? Because your feedback sandwich is a monologue. Well, this one now involves the learner. Learner is going to also be giving some reflection about their performance. You're going to be reinforcing the good behavior and correcting what was not done so well. And all of this is really being done in a short period of time, which means you are choosing what it is that you are going to be talking about in this particular session, right? And you end again by asking, explore a plan for practice and improvement. What are we going to do next, right? You will make some suggestions, or the learner makes some suggestions. You may agree with some, or you may make your own suggestion as to how the learner can improve our progress from that point on. And I believe this is the last one, the R2C2. Why is that? 2 R's and 2 C's, right? So rapport, we spoke about. Reaction. This one, I don't believe we mentioned from the others. It's really trying to get the learner's reaction to their own assessment. We talk about the learner who will, if they fail the exam, they cry, or they are in disbelief and they don't believe that they really fail, and so on and so forth. You want to get, where are they really? So they didn't do so well in the assessment. What are they thinking? Are they thinking that somebody cheated them? Or are they thinking that, boy, it was really that they need to work harder, or so on? So you want to get that information, get that from them in your conversation or in your feedback session. But the content educator explores the learner's understanding of the contents and results of the assessment. So you're really looking at the assessment. Do they really understand what the outcome of the assessment was? Do they understand why they failed, etc.? Excuse me. Coaching, and then at the end you want to adopt a position of, okay, so this is what I'm recommending that you do going forward, and this is how I can assist you. Or how do you think I can assist you going forward? Kind of. All right. So, to summarize what we just went through just now, is that effective feedback is a dialogue, is not a monologue. Focus is on performance, growth, and clear next steps. So a strong feedback culture reduces barriers, builds trust, and facilitates continuous improvement. Effective feedback is clear, specific, timely, accurate, learner-centered, and actionable, as we discussed. And feedback models provide structure, but impact depends on how skillfully they are used. So I'll pause here and take any questions or comments at this point. Yes, Miss Satchwell, please, I see your hand. Please go ahead.
Hi everyone. I don't have a question, but just a comment as the personal and professional development officer or wellness officer is the name of students. Can you hear me?
Yes,
Yes,
we're
I'm
here.
hearing you.
I have a very interesting perspective because when the students underperform, they're usually said to me, and the crying is a lot of stuff. A lot of times it's shame because our students are A-type, they're high accomplishers, high achievers, and they take the work seriously. And when they start to underperform at UE and in MedSci, we know that they internalize it. For some of them, they think about a lot of stuff. They don't have the money. They want to hide it from their parents, all manner of stuff, right? So the fears is about a lot of stuff. But a part of my work is to help them to problem solve and to engage with you guys in the feedback process. And sometimes I will send them to coordinators and lecturers to get feedback. And they get the feedback and they say something like, "Oh, miss, the lecturer said that I performed well in this area, but I didn't do well in another area, and I must just study." And then I'm wondering, what does that mean? You know? And so I'm saying this to say that I'm very glad that this conversation is being had. And I know we're coming from a meeting about feedback, and so this is just well positioned. The feedback is very important because somebody said that the students don't have insight. You're not incorrect, but feedback is that tool that you're going to be using to build that insight, right? And so when you give good feedback, you're telling them, okay, this is what you've done in this area. I don't know about medicine or the medical sciences. So if you're studying anatomy, you've drawn this anatomy very well based on the course outline or the criteria that we're looking for. This is what you've done. You've showed them how they've done it right in the instances. And the one where they're lacking, you engage them in the reflective kind of thinking style to say, okay, how did, like what we're talking about now, how did you think you fared here? And help them to kind of to develop that critical thinking skill that they need. And so when you engage the students in that type of reflective discourse, you're moving the student beyond just wanting to pass the course. You're really helping them to stimulate their critical thinking skills and also to be self-directed because that student now can take that feedback that you've given them and apply it to another course or another examination, that assessment that they're doing. So it's not that as I was going through the comment because because I was very interested because I was telling Dr. Gardner that this is a point of the education at UE that I'm very interested in as well. Because a lot of times when we do give feedback, and she said it, maybe it's culture, we tend to give feedback to the students themselves. And so we don't focus on their thinking. We don't focus on how they're processing the information. And I often say to someone that if you were ill over by UWI, what would you, and a student was stuck on a problem, what you want them to think about when they're stuck? How would you want them to be thinking about the problem when they're stuck? Yeah, like what voice you want them to hear? You want them to hear you criticizing them, or you want them to be able to regulate, hear your voice, walking them through the Socratic thinking styles that you have planted, because what you're doing, you're planting your voice in the clinicians and the students' mind for when they're stuck. And how do you want them to navigate when they're problem solving? And so that is what the feedback that you're going to be providing is going to be doing for them. So I'm very glad that we're having this conversation. That's it from me.
All right. Thank you, Ms. Atwell.
My question really has to do with something that Dr. Gardner said. Just to clarify, you said in an online feedback, you wouldn't ask the student to put their camera on. Can you say why?
Yes, I wouldn't insist on it. It may be that they're uncomfortable putting their camera on. Maybe they might feel intimidated, or I don't believe it adds anything necessarily to the feedback session if their camera is on. So because I don't want them to feel uncomfortable. The situation is I want them to feel comfortable in expressing themselves, and maybe if they feel that the camera is on, they are uncomfortable about it. It's like we are on this online session, and you do online meetings, and a number of time persons will talk, and I don't know what they look like because they don't have any camera, they don't have any photo, so I just hear the voice, and over time I may meet them somewhere and say, oh, I know that voice. That's how I know who the person is. Perhaps because again, the city where they are at is not convenient to turn the camera on, etc. Because sometimes when I am having the feedback session, it is I don't know where they're at. They may be in a bus coming from Maypen because they have a site. They go to have a clinical site there, or maybe they are at home relaxing, and so I don't insist on it, and I don't believe it makes a difference really as it relates to the quality of the feedback. No, it's a situation where you would rather see the student. I would say rather than insisting that the student's camera is on, perhaps you should schedule a face-to-face session. Because the student might take that as, a kind of what should I say, a commandeering kind of a thing, or a thing that where you are telling them what to do and they don't necessarily want that, or, that's my take on it. I don't know if anybody else have any take on it.
Okay.
I have a different approach, Dr. Gardner, because
Yeah,
one of the things that I noticed that our students lack is proper internet. I think, and I know my camera is off. I don't have a problem turning it on. I'm just conforming to the group. I find though that if feedback is meant to be effective, because one of the things that I notice with our students, they, as one person said, they don't have good insight. And so if feedback is meant to kind of stimulate their own reflective learning process, I do think that they should have a protected time to come and think and have a discussion with the lecturer. Because if the feedback process involves a dialogue and they're in a bus, for example, coming from ward, then it might not be fair to the lecturer who is giving the feedback. But then it's a personal preference. But for me, all students turn on their camera when they interact with me.
All right, so what I'll say then, and this is what I said before. So it is, what is the culture that you have created? So if you are going to have a feedback session with the students, and this is my take again, and you say to the student, okay, our session is going to be online, and the requirement is that your camera must be on, and it's going to be at such a time until such and such a time. And so it's all planned out and structured. So when you meet for that session, his camera will be on, or her camera will be on, and your camera will be on, because that is what was agreed on. I think what I was really hinting at is that if you have the session that was not discussed prior, and then you come and then you're now insisting that the camera be turned on. That might not be so appropriate because that was not discussed before. So I think it's all about ensuring that the student knows what to expect so that when the situation arises, then everybody knows we will be on the same page as it relates to that. But he's not coming and insisting now that something be done that was not previously discussed. So that's what I would say.
Thank you. Jacqueline Dunkley.
Good evening. Can you hear me?
Yes, we're hearing you.
Yes. I appreciate this webinar very much. There is something that I have been asking for a few years now, though, and that is, do the examiners or the associate lecturers or the lecturers get feedback from the students? Because we have been going on for years and we may be thinking that we are doing quite well. And if you were to ask the students, you know, they may say, boy, I'm not so sure if I learned that much from that doctor or from that lecturer. So I have been asking if there is any way that we can actually get feedback from the students. When they do internship, the interns actually assess the rotations they go through. So is there a way that the students actually assess the sites that they go to? And we can get feedback to know, okay, the students thought that, you know, we weren't very communicative. You know, I just want to know if there's a way that we can get feedback for ourselves as well.
Yes, that is absolutely correct. So we are to be getting feedback. It's actually one of the things that our auditors, CAMHP mentioned or asked about when they come. I know the program director for the MBBS program mentioned that this feedback that students are supposed to give to lecturers is really organized by someone in the office of the principal. No, and I think for the entire campus. No, so I'm not fully aware of what that process involves, but that's definitely something that I will be looking into because feedback should be given at the various levels. So students should be giving us feedback. Our peers should be giving us feedback as well. So lecturers should be getting feedback from other lecturers as well. And in fact, that was one of the things when the auditors in CAMHP asked that question. So other lecturers give you feedback. And of course, the answer is no, we don't really do that either. So again, a feedback culture is what we don't have. And I think, yes, we don't have. I mean, feedback is done in different pockets, but I don't believe we have really created that culture here, which we really have to do. So some lecturers do get feedback. And I understand that it's something that you have to ask for to see what the students say about you. So you have to ask for through your head of department because there is an online evaluation that's sent out to students for students to complete when they finish a course. And the uptake for that is very low from my understanding. So we know that's not going as well as it needs to and should. So that is one of the things that we will need to look into and ensure that improves because we should be getting feedback, as you rightly said.
Okay, thank you. Dr. Edwards says that emergency medicine, they do get feedback. Dr. Edwards, are you able to open your mic and tell us how you're able to encourage the students to give that feedback? Because the uptake is usually quite low when we ask for clerkship evaluations. Once they're finished, they move on. And usually they will make a complaint if they're dissatisfied, but otherwise we don't get that feedback. Is there anything that emergency medicine is doing that we should probably adopt?
Well, you know that Dr. Rhonda Hudson is the stage 2 coordinator, and she, I mean, it's her passion to do education and teaching. So yes, they very much have to give feedback. Honestly, you were on point with that by saying that, you know, when the clerkship goes smoother, they tend not to want to give feedback. I think we get more feedback from when things don't go as well. And lots of changes are made based on that, to be honest. I think Dr. Hudson listens to them a lot. and she actually compiles the list of the feedback. She compiles it, and once a year we have it's a self-funded, she reminds me, retreat, one whole day where we go through the curriculum as to, what is it that we do, what the grades are, the individual consultants, the actual performance of the students, and what are we propose changes to make things, fluid and so on. Because as you know, we suffer from many things in the emergencies, no secret with the overcrowding. And that sometimes, we have to be finding creative ways to ensure that we still impart the knowledge, because medicine, as was said before, is so important. As I will tell them, when my friends make a mistake, somebody lose some money, or a computer program goes down, or but when we make mistakes, people die. So it's kind of a lot more serious, and so that's why feedback is very important, from and delivery of the information is not just to pass the exam, but to learn and make sure you're competent in the area. So yes, we actually focus a lot. I think Dr. Hudson focused a lot on feedback from the students.
Thank you. Melissa Walker?
Yes, thank you. Just to support some of what Dr. Gardner said and possibly some other persons. So there is feedback that the students give through the online system that is sent to them. I know they were doing some, I'm going to call it refurbishing of that. I haven't seen what the latest iteration of that is, because I haven't seen anything come to me to say that the students have given feedback. So the uptake does tend to be low, especially, and I think some other person said it, if the students feel that, yeah, this class went well, man, everything was good. I think they more want to do it when they've had an issue. And actually, when I talk to my students, because usually I ask them during the class, so every 2 or 3 weeks, I ask them, okay, students, so, is there anything that I'm doing that I could do well? So I tend to ask for feedback in the class itself. And I ask them, sometimes I remind them that they should do the written one, and I give them the reasons why they should do it in general. Because a lot of what, if my memory serves me well, from what I remember of some of those assessments when I used to go through them, is so much the lecturer that they're assessing. It's more the things, having to do with the course, the structure of the course, the resources, that kind of thing. Yes, they might ask them 1 or 2 questions if the lecturer came on time, like that, but it's not so much the lecturer that's being assessed. I mean, is there room for that to happen? I suspect so, but I tend to do that a lot with my students. I ask them about the different techniques that I use, what was helpful, what didn't help, what they thought could have been different. And I think maybe that's stuff that we could do. But I do understand, though, that because of where I am in nursing, some of the structures are a little different. I tend to be responsible for an entire course. In some of the other programs, there are clerkships and different persons are responsible for different things, but you have one person that's overall responsible for 5 or 6 things. So the structure might be a little different in that case. But we do have to establish or re-establish or try to inculcate that sort of system where we're giving feedback and we're encouraging the students to give back. Because I know one of the things the students feel sometimes when I talk to them is, Miss, it makes no sense to do those evaluations, especially the more senior students that would have been in the program a little bit longer. They don't think that the evaluations make sense, because I think in their eyes, they are not seeing the changes within their group. And I'm saying to them, perhaps you may not see the change for your particular group, but it doesn't mean that the group that's coming after you is not benefiting from a comment that you would have made. So we really do have to encourage the students to do the evaluations. But at the end of the day, they still make their choices. But it's something that we really do need to encourage. Thank you. Those are my comments.
Thank you. Dr. Ricketts Rooms, and then Dr. Williams.
Thank you. I'm driving, so I hope my signal doesn't drop. Regarding the online assessment, or evaluation by the students. I don't know, because when, well, I probably dated myself quite a while ago, more than a decade ago, when we had a former deputy principal and the system worked very well. I mean, at the end of every clerkship, we would get back similar to what was just said a while ago, more the structure of the course, the lecture, not really so much the lecturer, but you got feedback after every clerkship. God, he knows what happened when they put it online. It was so bad that I don't seem to exist at the University of the West Indies because they didn't even have my name in the system. Albeit the fact that I was a lecturer for how many years? And I wrote emails until I was sick to Mr. Michael Card, who is the person responsible in the deputy principal's office. And to this day of our Lord, nothing. So what we have done in ComHealth is that we've done our own in-house assessments for each clerkship, and something that we have to look at and review to see if we can standardize. But at least that gives us some kind of idea as to what it is that's, is working, what's not working so well, etc. But I'm glad Dr. Gardner said that she's going to be following up on that, because we have to hold them accountable. Because truth be told is that when you're going up for promotion and things like that, your teaching assessments become very important. If they don't exist, then the lecturer who is putting all of this effort into teaching ends up with nothing. It is unfair to the lecturers because you don't get the opportunity to improve. And we are not holding the people accountable. I'm telling you, it's about 3 or 4 years I've written this man. And up to now, up to this day of our Lord, nothing. So I'm hoping that Dr. Gardner can really create some ruckus, because it doesn't make any sense. And even if we do the internal assessments, it's going to count for nothing if it doesn't come from the university central system. So it's really something that we have to address, and address urgently. Else nobody's gonna care. And that's the bottom line. Nobody's gonna care. So that's my 2 cents on the whole evaluation by the students bit.
Thank you. Dr. Williams, please go ahead.
Yes, good afternoon, and I'm really grateful for this webinar. I've learned so much, but essentially what I wanted to say was just said by the previous speaker, because going back some decades ago, I remember in emergency medicine, we had 2 forms, mark out of 10 each, 10 marks each. One was evaluation of the lecturer in terms of punctuality, delivery, etc. And the other form mark out of 10 was evaluation of the course. And these forms were sent to the dean's office or a committee where they were actually tallied. And in the past, when you're going up for your promotion, as said earlier, this is a requirement that you should give your score per year. I don't know how exactly they ask for it, but I've had that experience, and I have no score to report. Whereas senior persons to me had this evaluation, but there has been a breakdown in the system. So besides doing our own feedback in the clerkship, as Dr. Edwards rightly said, and Dr. Hudson doing that for us, the university as a body, it has not been executed as it was, and we presently have no records of what we have been doing, even during the COVID time, how we teach and so forth. And I think it's a good opportunity to reconnect, because that's very valuable, and those are precious records that we will need for many, many reasons. I just want to echo the sentiments of the previous 2 speakers before me, including Dr. Ricketts Rooms and Melissa, I think, that it would be good if we can reconnect and recalibrate so that we will benefit both our students and the lecturers. Thank you.
Thank you so much for all your comments. There were a few questions in the chat, Dr. Gardner, so I don't know if you want to just address those now. One question was, if you can't find anything positive to say, do you lie to the student?
The short answer to that is no, please don't. Please don't. So it means that for that particular student, all right, what you will need, okay, before we talk about preparing for your feedback session. So you will need to ensure that what are you going to give feedback on? So it was an assessment that they did, all right, and you observed them. So it was a particular a specific a task that you wanted them to perform, is that they did everything wrong. They did not even introduce themselves to the patient. Everything was wrong. So you may start off by saying, give them up something positive about something else that they may have done. Or you may not even have to start off with that, but you want to not lie to the students for sure. All right. So how it is difficult to speak without knowing the exact case. How you could frame or approach your feedback, but you don't want to lie to the student. That is definitely not going to benefit the student at all. I remember the goal is to help the student to improve their performance. That is your goal. Our goal as lecturers and teachers is that we are wanting to ensure that what we are imparting to the student, or what we are the learning that we are facilitating for the student, that it really happens. And so if the student really did not do anything right, then you need to spend some time thinking about how you're going to approach that feedback. Because but lying to the student is definitely something you don't want to do.
Thank you. Is there a role for AI in feedback?
AI has a lot of roles, but it depends on what you intend to use it for, because AI have inaccuracies. So when you ask a role for AI, do you mean probably generating a written feedback? Sure, you could, but then you have to make sure you read through that and ensure that it is saying what it is that you really want to communicate to the student. So I don't know if that's what you mean. But yes, AI is a very versatile tool, and it can be used for a number of things. But you have to be the person who's going to do the checks and balances. So I'm not sure if when you say AI and feedback, I'm not sure exactly what it is that you are asking about, but that is one way I can think of right off the bat, that it could be used to generate a feedback for a written feedback, but it's something that you will definitely have to go through and ensure that it is accurate and that you're communicating what it is that you want to communicate.
Okay, thank you. Can feedback be given remotely?
When we talk about the online, yes. So using any of the online platforms, it can be done that way. And let me go back to the AI. So, and back to the question before that one, where he said, suppose there's nothing good, you have nothing good to say. AI can help you to generate a structure. For example, however, you have to vet it. So you could put the scenario to AI and say, I have a situation, I have a student that so-and-so put the scenario, the entire scenario, as much of the scenario as possible. How would I approach this feedback and see what AI generates? However, again, you have to do the checks and balances and ensure that it is appropriate and fitting for the situation. You could ask a colleague to look at it, or somebody who's more experienced in giving feedback and so on. You could speak to a colleague about that situation, say, this is the situation I have. How do I approach this feedback for this particular student? So those are some ways to help with that. But giving feedback remotely absolutely can be done, because I did the medical education course remotely. I did not go to the UK. And so all my feedback was done.
Okay, thank you. Are there any special strategies you can use for students who lack insight, or the student who is very self-critical?
All right. Well, strategies that you can use. One, this is where now someone like Miss Satchwell will come in. Seek assistance when you need it. Okay, because if you know And there are some of our students who really have underlying psychological / psychiatric conditions, and you will need to be aware of that prior to going into a feedback session. And so having someone like Ms. Satchwell aware of what is happening and what you're going to do, she can advise on how you can approach such a student. So that is what I would say. If you have a situation where you have a student who you suspect, have deeper issues, psychological issues than you think you can handle, get help. Get help as to how to approach such a student.
Thank you. And then the last one is their ideal timing for giving feedback. For example, a competence or skill-based, do you need to give immediate feedback as opposed to probably like an essay or written task that you can give feedback at a later time?
Right. So we'll talk about giving feedback timely. So they want to give it the feedback as soon as you can. So on our ward one, for example, so this is not a summative assessment, it's formative feedback that I'm going to be giving. I can give the feedback immediately because I am going to observe the student examine and I'm going to just give them the feedback right away, depending on the circumstance. And I'm going to show you, if you stay long enough to see the short video, how that feedback was given. It was in a similar situation where the student examined a patient and then the preceptor stepped into the next room and gave the student a 5-minute feedback. So it really depends on the circumstance, or if you're busy, you have to go to clinic right after that exam. So say to the student B, I want to talk to you about this exam and tell you, how you're doing in this particular exam, but I have to be in clinic right now. Can we schedule this for tomorrow, just before ward round or something like that? So the student knows that you're not ignoring them. You're not trying to avoid the feedback. You want to give the feedback. And so they're anticipating this feedback. And so you plan it and set a time and location where this feedback will take place.
All right, thank you so much. And I'm just reminding everyone to complete the evaluation form. Don't be like the students. Thank you.
All right, so I'm just going to show these brief videos about giving feedback. And, if you have any comments thereafter, feel free to comment. So what I will say is that the first video that I showed, the doctor, the preceptor, gave the feedback, but you notice he didn't really talk about how she could improve or what were her strengths in terms of educating the patient. He just pretty much say, boy, and I'm just paraphrasing, you really didn't do so well because the patient ended up in the emergency room. And you can imagine as a student, that makes you feel like, dear God, I was harming the patient, kind of. But the second one is the same case. He mentioned, okay, you did a great job. You researched and you gave the patient the information about how to use the inhaler. But this was where you really made an error. It really didn't tell the patient how frequently she could use it. And so that was no clearer to the student that it was not, they were all bad. But this was where you really made the error. So I just wanted to point that out. And the last video was an example of the Pendleton's rules. All right, thank you very much for listening. Dr. James, over to you.
Thank you so much, Dr. Gardner, for such an informative and engaging presentation. We all learned a lot, as we saw in the question and answer session. I'm asking everyone, please, to remember to fill out the evaluation form. It will help to guide us for future sessions, and we'd love to get your feedback. Thank you so much for coming out and staying with us the entire time, even going beyond, and we look forward to having you in future sessions. Thank you again. And thank you, Dr. Gardner. Good night.